I've been getting sweaty hands since I think I hit puberty. Always sweaty hands. And the doctor ended up doing a treatment, and they still get sweaty sometimes, but it's almost completely, I think, eliminated it by like 80-90% of sweaty hands. Sometimes they were so sweaty, it's like I put my hand in water and then pulled it out. That's how sweaty, if I was very stressed out, that's how sweaty they would get, and it doesn't really do that anymore. Sometimes they still get a little sweaty, but not like before. And lower back, it feels okay.
Oh, okay.
And then my hands are still pretty dry.
So the hand sweating is
It's
still
almost,
dry?
most of the time they're dry.
Oh, nice. Perfect.
Because I start school tomorrow, so
Okay.
the stress starts tomorrow. Yeah.
Okay. Alright, so because tomorrow you are going to start your class, I want to do 2 more for your stress relief. Okay?
Thank you so much.
Yeah. I just want to make sure with you, you don't get, when you have this problem, you don't get any injury, right?
No,
You just poor procedure caused the upper
I
back.
think it was stress and maybe poor position, but I don't have the poor position anymore.
Okay.
Originally, it was down here.
Yeah.
But I was coming every week and
Yeah.
it felt great.
Yeah.
And then I started school, and then that was the poor position.
Yeah.
But after that, it never went completely away.
Do some needle here
Okay.
to relieve your muscle tension.
Thank you.
You're welcome.
A little,
A little bit here.
yeah, right there.
How about
And there, yeah.
And we will boost your kidney qi.
Thank
To
you.
nourish your kidney function.
Okay.
Kidney qi deficiency will show the patient have some symptom like a lower back pain. I'm so happy your hand sweating is controlled.
It's so much, sometimes they still wet, but
Okay.
it's not like before.
I see.
In April of 2021, I have 3 slip discs according to the CAT scan or MRI that they did on my back in my lower back area. But fortunately, it was mostly, I'm assuming, skeletal muscle pain, because the pain went away on its own after about 2 or 3 days. But I still had the discomfort. I could move, I could do my daily activities, but I had a lot of discomfort down here. So what took away that discomfort, I didn't rely on anti-inflammatories or any muscle relaxers or narcotics, because I didn't want to be taking a bunch of drugs. I didn't want to, drugs are processed, in the liver, and then, kidney for it to go out. And a lot of the side effects end up for drugs being, in the the liver, and then in the kidneys. So I didn't want to be doing that. And, anti-inflammatories damage the stomach. I don't want to get ulcers. So I was like, I'm going to try acupuncture. And that's what brought me here originally, because sometimes my back wouldn't hurt and sometimes it would hurt. So I started coming here to go ahead and relieve the pain in my lower back around the summer of 2021. This helped almost completely eliminate the pain. I have it very rarely.
When I saw him and I checked his pose, it's very interesting. The pose, the hard part, is more like a deficiency and weakness, and the pose shape is kind of thin and slow. So that means it's kind of hard chi, a little bit deficiency. In Chinese medicine, the sweating is related to our heart function. That make him like sweating. So when we treat him, we are not only tonify the kidney qi, we also have tonify his heart qi to help him kind of reduce the hand sweating and also for the back pain. And he's really good result from the hand sweating. After a few sessions, probably about 7 sessions, the hand sweating is kind of almost gone.
This year, I started nursing school. So since it's very stressful with all the stress, I started getting pain in my upper back between my shoulder blades. The doctor's been concentrating on my upper back, and it doesn't take the pain completely away, but it does help a lot with the pain. It takes it away completely for about maybe 2 days where I'm not in pain, and then I have to, come back for more treatment. But I think the reason I started getting so pain up here was the stress. Nursing school is so stressful that I personally feel that the the pain is made worse by the stress of nursing school. So it helps me control it because nursing school is never gonna not be stressful, you know? It's always test after test and hospital and long classes and taking care of people and people watching you. So there's a lot of stress and it affects me because I'm already injured, but I feel the acupuncture helps control it.
His low back pain almost about 90% better, but right now the upper back, because from the stress or from the studying about the nurse program, the stress still there.
As soon as they're done putting in all the needles, I already feel a little better. You know, I don't feel like, oh, completely normal, but I can feel it from the moment they start the treatment, like start working.
See a little bit reddish on the skin. That means the chi is going through this area. That means the needle is working for your back pain. Yeah.
Thank you.
We call in Chinese medicine theory, say this is kind of get chi.
Oh, okay.
Yeah, you can image like get energy. All right.
And by the time the treatment's done, that I walk out, I feel almost completely normal.